International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hi, I'm Rocco Palumbo. I'm a research fellow in organizational studies at the University of Salerno, where I achieved my PhD in economics and management of public sector organizations. I'm here to provide you with several introductory notes about a paper entitled Discussing the Effects of Poor Health Literacy on Patients Facing HIV, a narrative literature review, which has been published on the International Journal of Health Policy and Management. I just want to start these introductory notes with a brief policy remark. Most of healthcare systems are concerned with several common issues, including patient empowerment, patient involvement, and patient engagement. What all of these issues share is the attempt to reconceptualize the figure of the patient from the object to the subject of care. That is to say, the patient is incited to perform as a co-producer of healthcare services and as a co-creator of value. Most of the scholars and of the practitioners have just focused on the positive effects which could be ascribed to patient engagement in terms of both enhanced health outcomes and increased sustainability of well-being. However, poor attention has been paid to the requisite for patient empowerment and patient engagement. My point is that the ability to process, understand, but also collect health information is crucial for patient engagement and patient empowerment. Health literacy is the set of functional, critical, and interactive skills which allow the patient to navigate the healthcare systems and to properly interact with healthcare providers. From this point of view, health literacy itself is a key requisite to achieve patient empowerment and patient engagement. But, according to recent data, it is esteemed that about a third of the worldwide population is at risk of living with marginal or poor health literacy skills. Moreover, since poor health literacy has been associated with poor willingness to be involved in the provision of care, with poor self-efficacy perception, with poor health outcomes, as well as with increased rates of hospitalization and mortality, most of the scholars have conceptualized poor health literacy as a silent epidemic which is challenging the functioning of healthcare systems all over the world. From this point of view, with my study, I've tried to discuss the effects of poor health literacy on the appropriate treatment of HIV conditions, and for this purpose I performed a narrative literature review which involved 41 papers retrieved from Scopus and PubMed. With my studies, I have achieved a lot of significant findings, but in this circumstance, I just want to focus on 2 points which seems to be counterintuitive. On the one hand, poor health literacy is acknowledged to be an important social barrier to access healthcare services and to the appropriate treatment of HIV-related conditions, thus confirming the findings of the prevailing scholarship which identify poor health literacy as a determinant of impaired well-being. On the other hand, it seems that patients with poor health literacy are more likely to comply with clinical prescriptions, since they are not willing to challenge what healthcare providers prescribe to them in order to deal with their health conditions. So, what emerges from my literature review is a lack of consensus about the effects of poor health literacy on the treatment of HIV-related conditions. I invite you to have a look at my paper just to grasp with these critical issues and to share with me your observations about the importance of health literacy for the treatment of HIV and for the achievement of enhanced health conditions of HIV-affected patients. Thank you.